Okay, thanks very much, John. I need this to move the slides on. So as sort of John said, it's been a sort of an interesting year for the industry, and almost like it's kind of like disclosure. You know, that as a trade description, this is not going to be quite accurate because it's probably more losers and more losers. Right, that's it. Okay, so just to let you know, everything I'm saying, it's all my fault. That includes the slides. I prepared them, so any sort of spelling mistakes, etc., that's all down to me. And it's nothing to do with the people I work with, although I have obviously drawn on quite a lot of their data. So this is kind of like sort of gives you a sort of an idea of actually how the industry's doing. And as you can sort of see, that the FDA novel drug approvals is much lower this year. The blue is where we would be at the 1st of December of each of the years. And you can also sort of see there seems to be, you know, the FDA kind of wakes up when it realizes it's Christmas and decides to approve a bunch of other products. But you can sort of see that this is actually you know, one of the most unproductive years possible. Possible explanations could be around the fact that, you know, during the pandemic there was you know, a big focus on COVID-19, and therefore that might have sort of reduced the acceleration for getting drugs approved, or it could also actually just be the fact that there were delays with clinical trials as well because of the pandemic. So this is novel drug approvals. This doesn't include the vaccines and other biologics. And actually, as you can sort of see, interestingly, on the sort of the biologics front, I mean, you can see why 2021 was huge, and that was because there's quite a bit of vaccine activity going on. But you can sort of see that actually, when it comes to biologics, the run rate for this year has not been that bad. However, you know, when one actually looks at, you know, how the industry is doing, you can sort of see that after having sort of, you know, a pretty good year in 2021, this year the biotech sector is not in favour, and what we're actually sort of seeing is sort of the Nasdaq Biotech Index is down, the pharma index, however, is up. And you can sort of see that, and the healthcare sector index is up. So it's the sort of the innovative biotech companies that are actually the ones that are taking most of the brunt. There could be an argument that, well, maybe what we actually saw in 2021 was an overheating of the market, and therefore this is just a correction. But as we'll sort of see, that correction is actually going to have potential long-term consequences for the industry. So IPO financings, as sort of John mentioned, sort of the market's closed. It's been pretty much closed actually for everybody. It's not just restricted to the biotech sector, but you can sort of see that, you know, where we're at, we're back to where it was in 2017. And it doesn't look like the window is going to open anytime soon. And part of the reason is the fact that some of the guys who went out and sort of did IPOs in 2020 and 2021 have not done very well. And in fact, if you sort of look at it, sort of, you know, the figures are pretty stark. 226 biotechs completed IPOs on NASDAQ since the start of 2020. 183 of them are underwater. And, you know, that doesn't sort of, you know, give anybody any confidence. And as you can sort of see here on this slide here, the cutoff point was minus 97%. So it's like, it's pretty bad. And in fact, you know, there were 40 companies that actually saw declines of 90% on the share price that they had when they actually debuted with their IPO. There were, of course, some winners. So you can sort of see some of this is actually, you know, pretty impressive. And I think there we are. We've got Immunocore. So raw for the for the Golden Triangle. Yeah, but you can sort of see it's Massachusetts, California, but there's a lot of Massachusetts, and when we have this sort of debate later on, I think this will be a sort of an important point. In that class of the IPO class 2020 to 2022, 5 companies were acquired. Interestingly, Pandion was the only one that really went at a premium, and actually it was a pretty nice premium. It was almost 3x, well, just over 3x, when it was sold to Merck Sharp and Dohme. But the others actually were again sold at a discount from their IPO. So you can sort of see that is it's not encouraging either for people to sort of think, I'm going to go to do an IPO, or anybody who actually wants to invest in an IPO, because at the moment this is actually a license to burn money rather than print money. Similarly, when you sort of see the way that the markets have gone, follow-on financings have also struggled, and these are sort of relatively still big numbers, but you can sort of see it's again way below where we've been before. And the important thing is that this is one of the reasons why people do an IPO is that they want to be able to access those deep pools of capital to accelerate their innovation, etc. And when you sort of see sort of the brake on that, it's going to restrict people's opportunity to develop. And in fact, this is what we're now seeing. Sort of, this is industry at the moment is actually one that's in retreat. We're seeing, almost on a daily basis, companies announcing that they're having to, cut back on their workforce. There are a number of reasons for this. Sometimes it's because they've had a failure clinical trial, and therefore they don't need as many staff, particularly when it comes to sort of maybe commercialization. It could be where, in fact, a program that they thought was in the safe hands of a pharma company has been handed back to them. So again, their prospects have gone. But actually, quite a lot of it is around people sort of refocusing their activities, or actually just trying to conserve cash. So this is just a sort of a selection, and sort of some pretty big numbers. I mean, this one here is pretty amazing. Vesalius, sort of launched by Flagship Ventures, which is one of the sort of big blue chip venture capitals. They normally sort of incubate their companies for like 2 or 3 years under stealth mode before actually launching it, and yet within 6 months they're actually starting to retract. So you can sort of see that there are some issues. So you're lucky that this actually is the first thing of the day, so that during the rest of the day, when you hear sort of all the other great things that are happening, your enthusiasm is going to increase. Because if this was the last thing of the day, you'd all be thinking you're going to have a miserable Christmas. However, there's sort of like some relatively bright news. Venture capital financing is down on the previous 2 years, but they were absolutely sort of stonking, record-breaking. And actually, this year is still going to be the industry's 3rd best year. And similarly, actually, in the UK, it's going to be, again, one of the better years for venture capital. So there's still plenty of enthusiasm from VCs and private equity. Partly it's because they've raised a big chunks of money in recent years, and they're kind of obliged to spend it. But what we're sort of seeing is that there's clearly sort of large chunks of money going into selected opportunities. So here are some of the big guys that won. So the top company here is a French company, and it's kind of interesting because it's a sort of specialty pharma company. So that's always kind of weird. Where does that fit in the ferment? And what they did was that they raised this money from SocGen, so it was almost like private equity, and it was to buy assets from AbbVie. So it was to really sort of like jumpstart their efforts. But as John mentioned, there are a whole bunch of political headwinds that are again going to undermine opportunities for the industry. We're not necessarily sure exactly what the Inflation Reduction Act is going to have, what impact it's going to have, apart from the fact that most people actually think it's not going to be good. And we've already seen some companies again shelve programs and projects that they were working on because of the potential implications of this. John mentioned about the UK Autumn Statement. We've got a government that sort of says that it wants the UK to be a super powerhouse for the life sciences, and then it pulls the rug from under it. But we do know that this is still kind of a proposal, and I think Steve Bates and the BIA, with sort of help from people like One Nucleus, OBN, etc., have lobbied very, very hard once this came out, and I think there's some sort of discussion roundtable, sort of thinking, is there some way that they can sort of reduce the potential impact on this? But John sort of pointed out, one biotech company sort of said it's going to cost them $5 million. And when you sort of think about actually how much it costs to actually raise that kind of money, that's a huge, huge chunk. And another thing which is kind of interesting, this is again sort of, you think about winners and losers. At one level, when the FDA sort of puts out guidance around sort of increasing racial and ethnic diversity in clinical trials, that's got to be a good thing, right? Because unfortunately, for a lot of clinical trials, the trial population actually isn't that representative of the people who are actually going to be potentially treated. So therefore, there's a big push to ensure underrepresented groups are actually within that. And this guidance actually is sort of proposing, almost like with a stick, sort of saying you have to have a diversity equity plan, and you have to have it very, very quickly. And there can be sort of potential consequences if you don't have that diversity equity plan. So this is something that, again, sort of organizations like BIO in the States have sort of been lobbying the US government and the FDA to sort of provide some guidance that is not like super dogmatic. So I had these guys last year, and I sort of said, well, it's going to be a bad year for them. And it could be worse for Elizabeth Holmes, because actually she was on the hook for 20 years. So she's kind of like, 11 and a quarter years. She's kind of got away with it a bit. And Martin Shkreli, he's actually out now. He was released in May, but he had to go into a kind of like safe house. But actually, it happened to be the apartment of his partner. So it wasn't that. It was definitely a safe house, but it wasn't sort of under house arrest. But since September, he's fine. However, he got a $64.6 million fine. And when I looked at what his net worth used to be, I think it's all gone. So, yeah. So there is some justice, okay? So, now, this, again, so a couple of years ago, I had these guys on a slide. Jennifer Doudna, Emmanuel Charpentier. They'd won the Nobel Prize for Medicine for their efforts in gene editing, CRISPR-Cas9. And you sort of think, well, that's good, congratulations. And they were winners. However, what's really interesting is that when it comes to, while the Nobel Prize Committee sort of recognizes the contribution that these two made to that invention, the US Patent and Trade Office and the Appeals Board actually sort of said, yeah, no, we don't actually think that you own the intellectual property for this. It goes to the Broad Institute instead, which actually is based in Massachusetts. So now, this obviously is still a sort of a battle that's going to go on. But what we've seen at the moment is that there's going to be a kind of a sort of a turf war around sort of these gene editing technologies, because obviously some have got the access or license, the sort of the Berkeley, Vienna, Charpentier. It's normally sort of California, Vienna, Charpentier, CVC. Suite of patents, while others have got the broad. So it'll be interesting to sort of see how that all pans out. In Europe, however, they took a completely different view. And in fact, precedence is actually given to the CVC patent suite. And that's actually because there was a technical fault in the filings by the broad, where between one iteration and second iteration, they missed off a couple of people as inventors and had the permission of those people not to be on that patent. So they got chucked out on a technicality. So what we have is that Europe and the US have actually got a completely different view on who owns CRISPR-Cas9. So watch that space. And then finally, well, it's the World Cup. And I thought, you know, so talking about winners. So these are the flags of the 8 teams that have won the World Cup in its history. 4 of them are out. You know, poor old Italy didn't even get there. Germany, Spain. Did you see that? And Uruguay, they're out. And we still got Argentina, Brazil, France, and England. So they're winning so far. But it'll be kind of interesting to sort of see what goes on next. So I just sort of thought I'd end on a sort of a positive note, because for someone, it's coming home. So somebody's definitely going to be a winner. Yeah, thank you for listening.
We've got time for a couple of questions, not that I can see much with that light, but if anybody wants to put a hand up or shout. There is a roving mic if you want to wait to get to one. Can you see any? Oh, we've got one down in front of you.
Oh.
Mike,
Hello, Ted.
Mike, what's your crystal ball tell you? I know that's not fair, but what does your crystal ball tell you? When might we see maybe some kind of an uptick? 6 months, 9 months, a year?
Right, so Ted, if I knew the answer to that, okay, I don't know, I wouldn't be presenting here next year for a start. I think it's really difficult to tell. I think that you know, at the moment you can sort of see, you know, the way the markets have gone. And you know, we're seeing, you know, companies who were planning to do IPOs have decided that they're not going to do that. I think it's one of the things that we didn't see this year was, and it was kind of like expected, a huge amount of M&A activity, because that kind of gets people excited. And there are probably a few reasons for that. One, I mean, there are lots of reasons why it should have happened, but I think it's because of the sort of the geopolitical impacts on economies. People are just sort of, you know, a little concerned of, well, okay, do we want to start splashing out the cash? You've got a lot of people who actually don't want to sell at bargain basement prices. So it's only when they're, you know, completely on their uppers that they'll actually sort of, you know, put up the white flag. So I think that because we've got, you know, over the next 6 years, we're going to see about $90 billion worth of revenues, 90 billion a year. It's like disappearing. And therefore, we're going to sort of see companies are going to have to replenish very, very quickly their not only their pipelines, but actually get revenues. I mean, you know, Humira goes off patent in the States in the next month or so. We're going to see the entry of biosimilars. That's going to have a huge impact on that $20 billion a year revenues for AbbVie. You know, obviously, it bought Allergan, and it's been looking at other things, but I think that we're going to sort of see pharma companies will splash out. They've got plenty of cash in the bank, so there's a lot of dry powder there. So I think that once we see that, I think that that might get things excited. Sorry I couldn't be any more helpful.
I think you're free to
I
escape.
feel like the Grinch, actually. I spoke everybody's Christmas.
Well, on a good point, you don't look like the Grinch. You're right.
Right, I shaved off the white
I
beard.
noticed.
Yeah. Only because I just sort of thought, my God, he's got Father Christmas here. But anyway,
Thank you, Mike. Thanks.